Hello and welcome to my channel. Today we're tackling a complex and critical health topic, bilateral grade III nephropathy with acquired cortical cyst, and what that means in relation to your renal function tests, RFTs. First and foremost, a crucial disclaimer. I am not a medical doctor. This video is for informational and educational purposes only. If you or someone you know has received this diagnosis, you must consult with a board-certified nephrologist, kidney specialist. This information is not a substitute for professional medical advice, diagnosis, or treatment. Please, always seek the advice of your physician. Let's break down this complex diagnosis into simpler terms so we can understand what's happening within the kidneys. This simply means both kidneys are affected. Kidney disease is present in both the right and the left organ. This is the clinical term for kidney disease or damage. It signifies that the nephrons, the microscopic filtering units in the kidneys, are compromised and not functioning optimally. The grade III is a critical qualifier. While grading systems can vary slightly, in a general context, grade III often implies a moderately severe degree of damage or structural change. It usually suggests a significant reduction in the kidney's overall filtering capacity. This is often the stage where patients begin to experience more noticeable symptoms related to reduced kidney function. A cyst is a fluid-filled sac. Cortical refers to the outer layer of the kidney, the cortex. Acquired means the cyst developed over time, as opposed to being something you were born with. In the context of chronic kidney disease, these cysts are often simple, non-cancerous, and can develop as the kidney tissue changes over time. They typically don't cause major problems unless they become very large, but they are a structural finding to monitor. The most important part of this diagnosis is its correlation with the renal function tests, or RFTs. These blood and urine tests are the report card for your kidneys. The RFTs typically measure three primary indicators of kidney health.
Serum creatinine. This is a waste product from muscle breakdown. Normally, healthy kidneys filter it out. If your creatinine level is elevated, it is a strong signal that the kidneys are not filtering waste efficiently. A rising trend is a major concern. Blood urea nitrogen, BUN. Another nitrogenous waste product. Like creatinine, high BUN levels suggest reduced filtration, meaning the waste is backing up in your bloodstream. Estimated glomerular filtration rate, eGFR. This is arguably the most important number. The eGFR is a calculation based on your creatinine, age, sex, and race, and it tells us the percentage of kidney function you have left.
When a radiologist or specialist finds bilateral grade III nephropathy, they are describing the structural damage they see on an ultrasound or other imaging. The grade III structure is expected to correlate with a significantly low eGFR and high creatinine, BUN, on the RFTs. A grade III diagnosis structurally confirms the poor function seen chemically in the RFTs. It often places the patient in the stages of chronic kidney disease, CKD. Specifically, Stage 3 is common with this grading. This means the patient has mild to moderate loss of kidney function, with an eGFR typically between 30 and 59 ml min 1.73 m or 2. So if you or a loved one are facing this diagnosis, what are the next steps?
Immediate specialist consultation. You need to be under the care of a nephrologist. They will interpret the imaging, the RFTs, and look for the underlying cause of the nephropathy. Is it due to diabetes, hypertension, high blood pressure, an autoimmune disease, or something else? Finding the cause is critical for treatment. Treatment and management. Management focuses on slowing the progression of the disease. This often involves strict blood pressure and blood sugar control. Dietary changes, including reduced sodium, potassium, and phosphorus. Medications to protect the kidneys, like ACE inhibitors or ARBs. Regular monitoring. Both the RFTs and the cyst will be monitored regularly to track function and structural stability.
This diagnosis is serious, but it is manageable with diligent medical care. Knowledge is power, but proper medical oversight is essential. If you found this breakdown helpful, please like this video and subscribe for more health